Have you ever wondered if your body is trying to tell you something important? It's an intriguing thought, isn't it? Our bodies are complex machines, constantly sending us signals. But sometimes these signals might be more than just an indicator of a hard day's work or a sleepless night. They could be subtle signs of an underlying health issue. In this video, we'll journey through the fascinating world of our own bodies to uncover 9 telltale signs that something might be amiss. From changes in your skin to unexplained weight fluctuations, persistent fatigue to alterations in urination, and even shifts in mental health, these signs may be your body's SOS call. So, let's get started. Understanding these signs and what they might mean could be the first step towards better health and well-being. Stay tuned as we delve into these 9 signs. We're about to embark on a journey of discovery, decoding the language of our bodies. First off, let's consider your skin. It's not just a protective layer but also a fascinating communicator. Changes in your skin's color, texture, or appearance can be more than just cosmetic concerns. They can be your body's subtle way of signaling potential health issues. Think about conditions like jaundice, which turns your skin and eyes yellowish due to liver problems. Or those bothersome rashes, they might be an allergic reaction, or perhaps an indication of an autoimmune disorder. And let's not overlook unusual pigmentation. It could be a warning sign of hormonal imbalances or, in some cases, a symptom of skin cancer. Your skin can tell a lot about your health status, so it's crucial to pay attention to any changes. Don't dismiss them as mere beauty blips. They might be your body's SOS. So keep an eye on your skin, it might be trying to tell you something. Next, have you noticed any sudden changes in your weight? Weight fluctuations are a normal part of life, but when they occur without any changes in your diet or exercise routine, it might be time to take a closer look. Unexplained weight loss can be a symptom of several health issues, including hyperthyroidism, diabetes, or even some types of cancer. On the flip side, gaining weight without an obvious reason could also be a cause for concern. Conditions such as hypothyroidism and polycystic ovary syndrome can lead to unexpected weight gain. The key here is the word unexplained. If you're shedding or packing on the pounds without making any significant changes to your lifestyle, it might be your body's way of signaling that something isn't quite right. So pay attention to these changes. They might be subtle, but they're important. Remember, unexplained weight changes are not something to ignore. Moving on, do you often feel tired? If so, you might want to pay close attention. Persistent fatigue can be a subtle sign that your body is fighting an underlying health issue. It's not just about skipping a few hours of sleep or having a busy day. Chronic fatigue is a deep, pervasive weariness that impedes your ability to function normally. It can be a symptom of various diseases such as chronic fatigue syndrome, which is characterized by extreme fatigue that doesn't improve with rest. Anemia, a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues, can also cause you to feel tired all the time. Other potential culprits include thyroid problems, heart disease, and even diabetes. The bottom line? Don't write off constant fatigue as merely a side effect of a hectic lifestyle. It might be your body's way of signaling something more serious. Feeling persistently tired is not just about lack of sleep, it might be more. Now let's talk about something a bit personal, your urination habits. Just like your skin or weight, changes in urination can signal potential health issues. For instance, if you notice your urine is darker than usual, it could be a sign of dehydration, or, in more severe cases, liver disease. On the other hand, if your urine is consistently clear, you might be drinking more water than your body needs. Moving on, let's consider frequency. If you're frequently rushing to the bathroom, it could be due to a urinary tract infection, diabetes, or even an enlarged prostate in men. Additionally, a strong, pungent odor can also indicate a potential issue, such as a urinary tract infection or, in certain cases, diabetes. Remember, while these changes can be signs of underlying health problems, they can also be perfectly normal depending on various factors like hydration levels and diet. Your urine can provide important clues about your health status. Next up, have you noticed any changes in your digestion? Now, we're not talking about the occasional stomach upset after a heavy meal. We're referring to persistent changes in bowel habits or ongoing digestive discomfort. Are your trips to the bathroom more frequent, less frequent, or perhaps more urgent? Are you experiencing chronic bloating, gas, or heartburn? These might seem like minor annoyances, but they can signal bigger issues. Conditions such as irritable bowel syndrome or celiac disease often present themselves through such changes. For instance, irritable bowel syndrome is characterized by abdominal pain and changes in bowel habits, while celiac disease triggers digestive problems when gluten is consumed. It's important to remember that these conditions are just examples, and a myriad of other health issues can cause digestive changes. So, don't dismiss persistent digestive changes. They could be your body's way of telling you that something needs attention. Pay heed to these signals and consult with a healthcare professional if these changes persist. Do you experience persistent pain in certain areas of your body? This could be a subtle message from your body indicating a potential health issue. Persistent or chronic pain is not just an inconvenience. It's a signal that something isn't quite right. This pain could be localized like a consistent headache or widespread like the aching you might feel all over your body. Conditions such as fibromyalgia, known for causing widespread muscular pain, or arthritis, which can cause pain and stiffness in your joints, are common culprits of chronic pain. But remember, pain is subjective. It varies greatly from person to person, not only in intensity, but also in how it's perceived and tolerated. That's why it's crucial to listen to your body and not dismiss persistent pain as just another part of life. So if you're dealing with unexplained, persistent pain, it's time to consult with a healthcare professional. Remember, chronic pain is your body's way of signaling that something might be wrong. Have your eating habits changed recently? This shift could be a subtle hint from your body that something isn't quite right. It's not uncommon to experience fluctuations in appetite. However, if you notice a drastic increase or decrease in your hunger levels, it might be indicative of an underlying health issue. A loss of appetite could be a symptom of conditions such as depression, gastrointestinal disorders, or even certain types of cancer. On the other hand, excessive hunger could be a sign of diabetes or hormonal imbalances. For instance, an overactive thyroid can cause a voracious appetite. Remember, these significant changes in appetite are often accompanied by other symptoms, such as changes in weight, mood swings, or fatigue. It's crucial to consider these signals in the context of your overall health. So, pay attention to significant changes in your appetite. It might just be your body's way of telling you that it's time to seek medical advice. Do you often run a fever? It's easy to dismiss a fever as just the body's way of fighting off a common cold or flu. However, a fever that persists could be a signal that your body is dealing with something more serious. A persistent fever is generally defined as a body temperature that stays elevated for more than 2 weeks. It could be a sign of underlying health issues, such as infection or inflammation. Chronic conditions like rheumatoid arthritis, lupus, or even some types of cancers can cause this. Fevers are part of your body's defense mechanism. They help your immune system fight off infections by creating an inhospitable environment for viruses and bacteria. But when a fever persists, it's your body's cry for help, signaling that it's having a hard time getting rid of the problem. So, don't ignore a persistent fever. It's not just about feeling uncomfortable and sweaty, it's your body telling you it's time to seek medical help. Remember, a persistent fever should not be taken lightly. Finally, let's touch on your mental health. It's not just about feeling down or anxious. Significant shifts in your mood, cognition, or behavior could be signs of an underlying health issue. Perhaps you're finding it harder to concentrate or remember things. Maybe you're feeling unusually irritable or your sleep patterns have changed. These could be more than just a bad day or week. They might be signals from your body that something's not quite right. Mental health changes can be linked to a variety of conditions, from depression and anxiety disorders to neurological disorders like Alzheimer's or Parkinson's disease. It's not just in your head, your brain is part of your body, and it can also be affected by disease. Listen to what it's trying to tell you. Your mental health is as important as your physical health, so don't ignore any changes. So, there you have it, 9 signs your body might be giving you about your health. We've explored changes in your skin, unexplained weight loss or gain, persistent fatigue, alterations in urination, shifts in your digestive system, enduring pain, appetite fluctuations, a persistent fever, and changes in mental health as potential signals. These are your body's subtle ways of communicating possible underlying health issues. It's crucial to pay attention to these signs, as they might be the early warnings of something that needs to be addressed. However, don't let this information alarm you. These signs are not definitive diagnoses, but rather potential indicators that something might be off balance. The key takeaway here is that your body is a complex, intelligent system that often knows when something isn't quite right. Remember, if you notice any of these signs, consult with a healthcare professional. And don't forget to subscribe for more health tips.